Hello students, today we are learning venous system, function and application. Its competency is 5.7 and 5.10. So we are including this topic in self-directed learning. You have to keep record of date to date. This is 3rd June 2022. So this topic is important. Okay. Why? Because when you understand the venous system, you will understand the concept of varicose vein. There is also a 1 mark comment which is asked in past, which is spleen is a graveyard of RBC. Then you will understand the basic concept, cardiac output and congestive heart failure, cardiac heart failure. Okay, these are like full question. Ready? Entire different chapter. To understand them, you have to understand the concept of venous return, ready, and right atrial pressure, which is discussed here in this chapter. Okay. So first we understand the right atrial pressure. So how it is normally 0 mmHg, okay, but it is regulated by a balance between, okay, the ability of heart to pump out of the right atrium into the ventricle, then into the lungs, ready, and the tendency for blood to flow from the veins to the right atrium. So why we are talking about right atrium? Because we are learning about veins. As you can see in this figure, ready, that veins are directly opening, like superior vena cava and inferior vena cava, directly opening in right atrium. And there is, so the pressure of right atrium is directly reflected in the veins. So that's why we are discussing right atrium. So as you can see in this figure also, that right atrium pressure is reflected by two things like input and output. So output is ultimately going to the right ventricle, and to the right ventricle it will go to into the lungs. Fine, just follow the cursor. And input is from the venous return. Okay, so this is the guyton exactly. We are discussing its first page. Fine. So this portion I already discussed is covered here. It is very easy. You can read by yourself. Fine. But now, what are the function of venous return? Venous return can be asked as a short note also. So factor affecting venous return, everything is connected to cardiac output. Okay. So when the venous return will increase, the right atrial pressure will also increase. Fine. So when venous return can be increased, it can be increased in blood volume. Like you give someone 150 ml of saline or a blood. So there is a sudden increase in the blood volume, can increase the blood venous return. Then under some stressful condition, when you there is a sympathetic we are learning this second point, sympathetic stimulation leading to vasoconstriction of a veins. So suddenly all these veins are constricting, so ultimately the flow venous return increasing in this right atrial pressure. Or you can see, okay, by a longer route that you are dilating the arteries, there is an excessive dilation of arteries. So from blood arteries to veins, blood pass on very fast, okay, because of massive dilation. So ultimately on a longer run, there is a more blood coming to the vein, coming to the right atrial pressure. Okay, very good. So now you have to remember this, because as a clinician also, when you are working in ICU and when you are monitoring a patient of heart failure, you have to continuously be vigilant about the central venous pressure system. Okay, ready. So normally it is 0 mmHg. Why? It is normal atmospheric pressure. Okay, around us is also 0 mmHg. Fine, but it can be massively increased in a 20 to 30 mmHg in a serious heart failure or after massive transfusion of blood. Okay, it can be a massively decrease also. So you have all studied the anatomy and you know that our normal chest cavity pressure is -3 to 5, which is negative, okay, sub-negative, sub-atmospheric pressure. Ready? So when your right heart is pumping excessively and blood volume is less, like the case of hemorrhage. Barabar? This point is telling that this minus 2 to 5 mmHg pressure can be approached when there is a very low volume of blood in case of hemorrhage and heart is vigorously beating. Okay, so this minus 3 to 5 can be approached. Okay, this is the lower limit of right atrial pressure. And again, what are we going to learn ahead? So as you will read this chapter ahead, you will see that Guyton has further explained the factor affecting the venous pressure like gravity. Okay, so there is a very beautiful picture here in Guyton if you focus. Okay, this same picture will be repeated in surgery also. Okay, when you are learning the chapter of varicose vein. So you can see the gravity effects. So here it is 0 mmHg. So that's why we always measure the BP at the heart, which is a 0 mmHg. Okay. So as you can see, gravity is playing the role. So sagittal sinus pressure is minus 10 mmHg. Okay. As you can see, moving downwards. Ready? When the blood flow has pump against the gravity. Fine. So the pressure is plus 90 mmHg. So it is very basic. As you can see, sagittal sinus blood has to flow in line with the gravity. So gravity helps. So that's why it has minus 10 mmHg. But the veins, the blood from the veins has to flow against upward the stream, against the stream. So minus plus 90 mmHg. Okay. So even there are other things also, like if you remove the factor of a gravity and a person is just sleeping. Okay, this paragraph is stating that even if the person is just sleeping and we remove the factor of gravity, there is, look, there is a kinking, hai na? Kinking by first read. The veins are just slit like, they are obstructed, minorly obstructed or pressed by the first rib. Also, the abdominal organs here, the abdominal organs will press the veins. So that's why you have plus 4 to 6 mmHg, even pressure in veins, even when the gravity effect is removed. Okay, so this page tells only these things. You can go in a fast read. There is nothing very difficult here. But yes, we are talking about here is a clinical application. Okay. So this page also says that clinical application. What happens if we have a pregnancy? Okay. Like abdominal pregnancy or the ascites where the abdominal pressure is 20 to 30 mmHg. So you can see the vein has to pass through this abdomen area. So it will create a increase in a pressure of a venous system. Ready? So this is described in this paragraph. Okay, the application of ascites and, ready? Okay, pregnancy. So we have already discussed this, the effect of gravity. But yes, there is a two very good comment I would like to say. That when we when we are in a sinus surgery, there is a chances of very high chances of air embolism, and there is a function of venous pump. Okay, and why it happens in a surgeon. So this concept are if you focus on this image, you can see there is a minus 10 mmHg. Okay, so it is a subatmospheric pressure and there is no air. You mark my words, there is no air inside our vessel system, no arteries, no veins, not a single. Okay, a small amount of air. So when suddenly this sagittal sinus is open, the air gush. The word we use for a rapid flow is gush. Okay, so the air rush and gush into this sagittal sinus, and it will create a air embolism, and which can be fatal. Okay, so this is the one thing. And look, when you are observing that surgeons and traffic police are standing for a longer time. Ready? So this plus 90 mmHg Okay, the gravity is causing very high pressure in the legs veins. Okay, so what this high pressure will do, ultimately it will shift the fluid out of the veins and into the this legs. It will lead to the edema, and ultimately the circulation is hampered, which will lead to the ulcer. Okay, and painful muscle spasms. Ready? So we call this varicose veins. Ready? But this is naturally doesn't happen in normally, because we have a, yes, a anatomical concept. Remember the anatomical concept of this valve. Okay, so whenever we move our legs, so the muscle pump will help, will squeeze these veins, and ultimately the blood column is passed upward and it doesn't move downward. Okay, because of this valve. So when we are walking in between and sometimes stretching our legs and making leg movements, so it is not the plus 90 mmHg, but it is around maintained plus 20 mmHg. Okay, so that's why we, in aeroplane, when we are flying for long hours, it is suggested, okay, to just move your leg and do exercise, ready, to avoid such things. Okay, but when surgeons standing for very long time every day, and even soldiers, you know, this example is given here in guyton, that when soldiers remaining standing for very long time in a rigid position, so within 30 minutes, it is amazing, within 30 minutes you lose your 20% of volume through edema into the legs, and person might faint. Okay, so to avoid this scenario, you have to keep your legs moving. Okay, so this was up to this moment, this was explained in the guyton. Okay, it is very easy words and you can remember it very well. Okay, super. And now when we are moving ahead, yes, this is the box. What I want to say, students, that this box is about measuring the venous pressure. So as I told you that it is a 0 mmHg. But why it is important? When you are managing a person of what we say CHF, है ना, and so many clinical condition where this measuring is very important. Okay, so this is in a very easy language and you can read here by yourself, as this is a self-directed learning activity, so students are supposed to do by themselves. Okay, even if they feel any difficulty, the teacher is there, I am here, I will help you. Okay, ready? And now in the end you will see that there was a comment, this comment, spleen is a graveyard. Okay, spleen is a graveyard. Yes, spleen is a graveyard for RBC. This is a comment which is asked frequently. So why? So for that they have discussed in a very detail the structure of a spleen, which you know by anatomy. Okay, so you know already this. Ready? So spleen has this trabecular meshwork. Okay, which forms a red pulp. This area. Ready? So this is a very, is a trabecula. Okay, so trabecula is a very open, they have very open space from which the RBC can plasma and RBC are squeezed and they are stored here. So this red pulp is a very concentrated RBC area. Ready? So it acts as a reservoir of RBC also. Fine. Ready? So whenever there is a need, the spleen will contract and this excessive RBC will go back to the circulation. But be aware that this trabecula, okay, the RBC have to squeeze very, this is a very narrow space. Trabecula is a very narrow space. No doubt the number is very high, but the space is very thin. So they have to squeeze themselves very forcefully out of this trabecula to reach here into this. Okay. So the old age RBC, the new RBC will manage this, but the RBC we are about nearby 120 days, which are old age, they lost their flexibility. So during this passage through this trabecula, they are what? There is a wear and tear. Okay, so they are destroyed. So when they are destroyed, there is also an There is a system called reticuloendothelium system. Okay, ready? So they pick up the remaining of RBC. They process the hemoglobin and the protein. Okay, ready? So this is also reticuloendothelial system of the spleen. Another advantages of this reticuloendothelial cell of the spleen, they just don't phagocyte the RBC and uh, uh, recycle the RBC garbage, but also they protect. How they protect? Because this area is extensively yes, the macrophages, the phagocyte. Okay, uh, they protect our blood from bacteria and other parasite and for debris. Okay, ready? So this is a protective function of spleen thanks to its extensive venous system, venous sinuses, and the trabecula. Ready? Also there is a, because of this venous system, the spleen, the liver and lung. Okay, because their veins is a very compliant, as we discussed in a previous lecture. Veins is very compliant, distensible, so they can store the blood. Right? And when we need, so under sympathetic stimulus, these veins will constrict and they can give some around 100 to 200 ml of blood, the lungs and liver and spleen and everybody. They can contribute in systemic circulation. So veins also act as a reservoir. So spleen is doing a blood cleansing function, right? By removal of all RBCs.